Live from Studio 3C at Rockefeller Center, this is News 4 New York.
Last week, the Drug Enforcement Agency announced that it is tightening restrictions on hydrocodone combinations. That is, listing drugs like Vicodin and Lortab as Schedule II drugs under the Controlled Substance Act, moving them into the class of morphine. The reason is to stem the rise in abuse of the powerful painkillers. But what effect, if any, will these rule changes have on those who depend on these drugs? I'm joined now by Dr. Ajay Suman. He is a board-certified pain specialist at St. Barnabas Hospital in the Bronx. He previously worked in the pain medicine department at Tripler Army Hospital Center in Honolulu, where he treated soldiers returning from active duty in Afghanistan and Iraq, as well as past wars. Dr. Suman, thanks for joining us.
Absolutely.
A lot of talk these days about opioid abuse. Essentially, the big question, why now for moving these drugs, particularly hydrocodone combinations, up on the chain of regulation?
Well, they've been talking about these rule changes for the past 10 to 15 years. Over the past couple of years, as you know in the news, prescription abuse has become an epidemic in America. Actually, more than 40,000 people have died from prescription overdoses in the past year, more than car accidents and gunshots.
And tell me a little bit about what hydrocodone is used for. We hear so much more about oxycodone in the news and the abuse and diversion of that drugs. Is this much different from oxycodone?
They're actually chemically similar. They're almost considered cousins. They're both opioid medications or narcotics that are used to treat pain. So hydrocodone is commonly used to treat mild to moderate pain and sometimes in some cases severe pain.
So bumping up hydrocodone on this DEA schedule, what does that mean for you? Will it make it more difficult to prescribe this? Is your prescribing more closely monitored?
So when you're a Schedule II prescription, a lot more falls on the physician as well as the office. More paperwork, more oversight, more staff is needed, as opposed to simply writing a prescription for an acid reflux medication that's not controlled.
And what difference will this make to patients? I mean, you have treated patients with severe injuries. We talked about your work with veterans returning home from war zones. Will this make it hard for them to get a hold of these drugs?
You hope not, but with the increased regulation that falls on the physicians, some physicians won't be able or willing to prescribe these medications. So there may be a decrease in access to care for some of these patients.
You know, it's nothing new to talk about the diversion and abuse of opioids. And I'll bet a lot of viewers are wondering, why is it that it's just now that hydrocodone is being bumped up to a more serious level of regulation?
Well, before it was 15 milligrams or above of hydrocodone was regulated at a C2 level, but now they're moving all doses. And before we used smaller doses combined with Tylenol, and with the Tylenol there, you can't really abuse the medications as easily, but it's still being abused.
And we've heard so much about how states are trying to crack down on the abuse and diversion of opioids. Is there any way that this new federal regulation is going to interface with efforts in New York, New Jersey, Connecticut, other places to try to make sure that these drugs are going to the people who need them and not to the ones abusing them?
And that's the tough part. This is a step in the right direction. Other things do need to be made. Changes need to be made, such as pharmacies in different states talking to each other. So if a patient is going to a physician in New Jersey, as well as New York, currently there's no way for the pharmacies to speak to each other.
I think one final question that many people ask is, when do you prescribe something as powerful as hydrocodone or a hydrocodone combination? I mean, that's for a serious injury or serious pain, isn't it?
Well, after you talk to a patient, you find out if they have moderate or severe pain. I usually use a pain scale, 0 to 10, 10 being the worst. Patients that have a broken arm that are recovering from surgery, all the way to patients with terminal cancer. All of these patients in between can fall into a category that may need hydrocodone for a short period of time.
Well, I want to thank you, Dr. Ajay Suman, for joining us here and telling us about how hydrocodone is going to be regulated under these new rules. And obviously, it will lay a little bit more burden on physicians like you, but it sounds like this is important to try and reduce some of the abuse.
Absolutely. Thank you very much.
Thank you.